Endelea kutazama Capuchin TV, huduma Katoliki ya uinjilishaji.
In a world where health information is everywhere, but clarity is rare,
Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth.
Well, hello and a very good morning to you, our dear viewer of Capuchin TV, from wherever you're tuning in from, and welcome to the Health Corner Show with me, your host Susan Bulemi, of course, sitting in for Maureen Kimani. And on today's episode, we will be having a discussion on the World Breastfeeding Week, and of course, I'm joined by a nutritionist from St. Mary's Mission Hospital who will introduce herself in a few, and she's going to help elaborate more on today's topic of discussion. She's going to help create more awareness and give advice and also educate us more on what we need to learn about breastfeeding. And of course, this being the breastfeeding week, the theme is breastfeeding for a sustainable start in life, strengthen what works. That is the theme for the breastfeeding week. And of course, St. Mary's Mission Hospital will also be having an event on the 6th of August. And we're also going to talk more about that with my guest here today, just to create more awareness on that. But remember, our dear viewer, if you'd like to participate, if you've got any questions or you'd like to send us your feedback, you can always send us on our SMS number 21760, or you could also leave us a comment on our social media handles, that's on YouTube, Facebook, or also on TikTok, and your message will be delivered. Now, without further ado, I'd like to give my guest the opportunity to introduce herself. Karibu sana.
Thank you very much for having me in the show. My name is Dr. Sobule Anyango from St. Mary's Mission Hospital, Langata, nutritionist, and we are here to just elaborate more and give emphasis and elaborate about breastfeeding, which is very important for the first 6 months of life and also after 2 years. So the most important thing here is breastfeeding for the optimal growth. Yeah.
Wow, thank you so much, Dorcas, and we are glad to have you on set today.
Thank you.
And we do hope our viewer will get to learn a lot from you.
Yeah.
And of course, we're talking about breastfeeding, and it might seem like a normal term, but maybe if you could just explain to our viewer.
Basically, breastfeeding is just a natural way of feeding the baby with mom's breast milk. And it can either be done directly through the breast, or there are some mothers who will express and leave for the baby to feed on through the cup and the spoon. So it involves breast milk being given to the baby for the first 6 months of life, and there are those who will continue until 2 years. So the main thing here is the breast milk from the mother. Yeah.
Oh wow, thank you so much for that. And when you talk about breastfeeding, we always hear the term exclusive breastfeeding. Maybe if you could get into that.
Exclusive breastfeeding is the feeding of this baby from birth. Actually, we recommend that we breastfeed the baby at least the first 1 hour after delivery to when the baby clocks the 180 days, that is at 6 months. So we do exclusive, meaning that you're not giving anything else. There are mothers who give water, there are those who give a little concoction of water and salt. But exclusive breastfeeding means that you only give mother's milk and maybe medications that have been prescribed by the doctor. But nothing else is involved during the exclusive breastfeeding. And it is one of the key major things that we are talking about during this time of breastfeeding. I remember the breastfeeding week starts on 1st of August. It runs through to 7th of August, and it is something that is supported by the WHO, the UNICEF, and many Ministry of Health in the world. And it is something that has been practiced since 1992. And at this point, we are seeing it picking up, and many mothers are being mobilized, and they are putting emphasis on it. Actually, at some point, statistics show that we are at 66%. So we are just hoping that as time goes by, we'll be able to get to a percentage of 80, so that the benefits of this exclusive breastfeeding can also be seen in the coming generation. Yes.
Oh, and okay. Earlier you've talked about how breastfeeding is really important, especially for a baby after 1 hour till 180 days. That's
Yes,
6
yes,
months.
yes.
So when we have an instance whereby it's not possible, probably the mother is not present and the baby is not yet 6 months, what happens in that case?
Yeah, there are these special occasions, like in the unfortunate event whereby the mother maybe passes on when she's delivering the baby. Then it's fortunate that at this moment we have breast milk banks. At Pumwani, we have one where mothers are breastfeeding milk. They go through the process of examination and storage. Then these babies can still get it from there. But if it is not possible, let's imagine this, because we are talking about it working where it's workable. So this mother maybe is in the rural home. That is now when we opt for the baby formulas. But again, we ask ourselves how sustainable it is. Because if you look at the price of baby formula, not all of us can afford.
Yeah, true.
So the unfortunate events, yes, they do happen. And at times when people are so pressed so much, they get themselves in a situation whereby some can even give the cow's milk, which is very wrong. Because at this point, this baby is not able to digest the cow's milk. So if it comes to that, an event whereby the mother is not present, there are those mothers who even give birth and they go to the ICU. And the baby is left maybe in the nursery or in the care of a nurse. Then that is where the baby formula comes in. But if you can breastfeed, and you have the advantage of getting that breast milk, kindly breastfeed your baby. Yes.
And still in the same breath, what about for the babies that are usually born maybe premature, before the time? Do they still get to be breastfed by their mothers, or do they undergo a different method?
It all depends, because when a baby is born prematurely, some are able to have the sucking reflex, some are not able to. And for this baby, most of the time you get that they are admitted in the NBU or PICU. And when they go there, NICU, sorry, and when they go there, they are started on fluids. Most of the time they are started on fluids. Then after the doctors have assessed and they are comfortable that this baby can breastfeed, that is when we start breastfeeding. But before we even do the proper attachment, at some point you can start with the expressed breast milk. But in small quantities, as we prepare this baby for digestion, and also as we prepare the baby for breastfeeding. But when we're introducing now the small quantities of the breast milk, we don't do the bottle. We do cup and spoon. Because even the Breastfeeding Act is discouraging us from using bottles and even pacifiers and even baby formulas. Because at this point, if you introduce a feeding bottle to this sucking the breast is not an easy task. So if you introduce the bottle feeding, it is easy to suck. So it confuses the baby between breastfeeding and the bottle feeds. Plus, how sure are we that the hygiene of the bottles are up to date? So yes, we give them breast milk, but at the point when the doctor feels that it is comfortable for this baby to breastfeed. Yes.
Okay. And why would you say, or rather, why is breastfeeding considered the best source of nutrition for infants?
The first 6 months of life, as a mother, your milk has all the nutrients that your baby needs. From the macro to the micronutrients, they are all in your milk. And that is why we always prepare our mothers, especially at St. Mary's, when they come during pregnancy, we talk to them about their diet. Because that is the point when you're building up all the nutrients for this baby. Most of the time when our mothers give birth, what do we tell them? take warm fluids, take uji, take chai. At this point, we are talking about quantity. But before the baby comes, we should really focus on the quality of the milk that our baby will get. So when this baby is breastfeeding, the first 6 months when you are emphasizing, don't give any other food. Your milk has everything that the baby needs. The milk has 2 parts. It has the fore milk and the back milk. So when you talk about the fore milk, this is the milk that comes early, and it is watery. So it has the watery part of the milk, which means that you should not be giving your baby water. Then now the hind back of the milk is this milk which comes very thick, and it drops like a tap which is almost getting over with water, and it has all the nutrients that your baby need. So the milk caters for the thirst and even for the nutrients that your baby need. And remember, the first milk that your baby will get, the colostrum, it is very rich. So basically our baby will get everything that they need from there. Yes.
Okay. And the same way there are health benefits for the baby once they breastfeed. Are there also benefits for the mother, or?
Yeah, there are. And for the baby, I didn't mention, once you give them the breast milk, you're also preventing them from getting germs. Remember, it is from mommy to the baby. So there are no germs involved. So when you give them the breast milk, you're preventing them from issues to do with their stomach, from ear infections, from getting colds. And again, it gives them a benefit of reducing the risks of diseases later in life. A baby who is gone through exclusive breastfeeding for the first 6 months will lower the chances of this baby getting obesity in future, type 1 diabetes. And you see, we are looking at the future, not now, like 30 years down the line, what kind of generation will we be having? And also for this baby, it helps the baby to bond with the mother. Because when you're breastfeeding, there's a lot of chemical reaction and hormonal that is involved. So if this baby will breastfeed for 6 months with the mama, definitely they will grow up having confidence, intellectual will be okay. Their babies will be sure that in future they are able to make decisions which are accurate for the life. Now when it comes to the mother, it is also a very important part of their life, because during breastfeeding, especially the first few hours and the first few weeks, it helps the uterus to shrink back to its normal size. Because now the breastfeeding will also help the hormones to coordinate. Then for the mother also, it helps the mother or reduces the chances of this mother getting breast cancer, ovarian cancer. It reduces. It won't prevent, but it reduces. And it is also a bonding time for the mother and the child. So all the benefits that are there for the mother and the child are all very important. So it is important that it is also very important that at this point the mother also gets support from the family and even from fathers. Breastfeeding is not about the mother only, even the father should be involved. Yeah.
Wow, wonderful. That is a challenge to all the fathers out there. I hope they are listening also.
Yeah.
And as a nutritionist, you said that earlier, but maybe if you could also just get into details. What diet would you recommend for a mother who is breastfeeding? Maybe what types of food should they do? And also, which type of food should they avoid?
Okay, so what happens, I would be unfair to say that you should talk to this mother when they now get the baby. As I said before, at St. Mary's, we do the preparation before delivery. So when a mother is expectant, we advise them to get breakfast, mid-morning, lunch, mid-afternoon, dinner, and then we have a snack after dinner. That is for an expectant mother. Now, when this mother has delivered and we are now breastfeeding, remember she's eating for 2, right? So what we are going to do is that we are doing the same thing we are doing during breastfeeding. During expectancy, we are doing breakfast, mid-morning, lunch, mid-afternoon, dinner, and then we are having 2 snacks before she goes to bed. This means that our mother should eat her dinner early, because it will not be practical to tell a mother to have 2 snacks after dinner and she's getting her dinner at around 9 or 10 p.m. So it really needs proper arrangement, and it also needs a lot of support from the mother. Basically, this food should have all the food groups. And we also stop this issue of telling mothers have balanced diet. nowadays we talk about food groups. And if you look at the food groups, there are 10 of them. So for this mother to have sufficient nutrients in her body, then she should have 5 to 10 of the nutrients. It is not something away from what we were practicing before. It is almost the same thing. But now here it's classified into nuts, milk, eggs. Then we are having meats. And then we are coming in with the grains. We are coming in with the carbohydrates. The basic things that we can afford at home. But now a question comes in, what if this mother cannot afford? Because there are those who have given birth, but they cannot afford. Remember, part of our theme for this year is what works. So whatever is available in this house, let this mother eat. Because in some setups, you have ugali and boga. We will not force this lady to go and look for beans, to go and look for meat. Let us use whatever we have in the house. Let the mother eat as many times as she can in small, frequent quantities, and let us have fluids with us. Most of the time, what we tell our mothers to try and reduce is wheat. Because our mothers, when they do a lot of wheat and they are breastfeeding, then our babies are at risk of getting allergies like eczema. They are at risk of having weight which is not very good. So we are not cutting down on them completely, but we are asking them to reduce and maybe go for the whole grains if it is possible. Whole grains, I mean things that are whole, like instead of doing white bread, they can do brown bread. Yes. Yes.
Okay, thank you so much for that. And are there usually instances that maybe a mother is struggling to breastfeed, maybe due to lack of enough milk production? And what causes that?
When a mother is struggling because there is no enough milk, there are so many contributing factors. Number one, we look at her food intake. Is she getting enough? Number two, we also look at her stress levels. Any lady who is stressed will not be able to give us enough milk as we want. So we also try to calm the mother down and make sure that they are comfortable enough for them to breastfeed. It could be also because of an illness. We also have to check the mother further and find out if what is really happening. And at times they tell us they are not getting enough, and it could also be attachment issues. Maybe they are not attaching their baby properly for the baby to get the milk that they're supposed to be getting. So it involves the health workers, it involves the support at home. So before we conclude that the mother is not getting enough, we have to assess with her permission the breast production milk. When we are sure that it is there, then we help the mother on attaching the baby properly to the breast. If it is not there, then we encourage the mother to take warm fluids. And at times we go further into helping them by the medications that help them to produce the milk there.
Okay. And in the years of experience that you've had, what are some of the myths or misconceptions that you've had out here about breastfeeding?
There are many, depending with the culture.
Yeah.
There are those who believe that boys should not be breastfed for 6 months because they feel hungry earlier. There are those who believe, this one I've heard, but I'm not yet sure, I've not seen like firsthand that breast milk is for the fathers. And there are those who, our generation now, the young people, some of them do not want to breastfeed because they feel like it will get them out of shape. So it is something that we really need to practice, because after breastfeeding, this baby fat will go and you'll come back to your usual shape. So let us not deny our baby's milk in the name of culture, in the name of I don't want my body to lose shape. Because at the end of the day, we are not looking at this baby tomorrow. We are looking at this baby years after. What will you have given as a foundation to your baby?
Very true.
Yes.
And I also forgot to ask this earlier. Are there instances whereby breastfeeding could be painful, and maybe what causes that?
Yeah, it all starts with the attachment. Yes. So if we don't attach the baby properly when they're starting to breastfeed, chances are very high that they may cause cracks. And these cracks, if not taken care of, the mother will be afraid to breastfeed the baby on that breast. Then that means that milk will accumulate on that breast. And then now it accumulates to an infection. So this ends up being painful, and this ends up giving mother maybe even complications that can land her even in ICU. So it all boils down to attachment from the first day. Yes.
Okay.
So health workers, let us really help our mothers on attachment. It really helps us to prevent so many complications that can come in the name of breastfeeding. Yes.
And also you had talked about this earlier, but maybe you could just get into detail about it again. At St. Mary's Mission Hospital, how do you support, or rather how do you prepare these mothers, especially when they are still expectant and now when they're in the process after they've given birth and now it's time to breastfeed their babies?
What we do at St. Mary's, when you come for your first clinic, there is a particular profile that you have to follow. There's some tests that you go for in the lab for us to be sure that you're okay. These are maybe to mention but a few. We check your blood levels, we check your sugar levels, we also check infections in case you have any. Then during this time, as we take you through the 9 months, every month you come to the clinic, you are able to sit down with a nurse, you're able to sit down with your gynecologist and nutritionist, so that anything that is creeping in, we are able to curb it at that point. Then also during pregnancy and even during breastfeeding, we always have education for the mothers, and we do it two Wednesdays of the month, whereby we come with a support group for the mothers. We sit them down, we have a talk with them. We have it's like an education, but it is very interactive. This is where our mothers are able to get all the information that they need. We also have discussions from fathers. We don't only do it to the mothers, so that this mother has confidence about breastfeeding and how to take care of their baby. So when they also come for the immunization at 6 weeks, at 10 weeks, 14 weeks and going forward, they also have the opportunity to talk to the pediatrician and nutritionist on the same. So they are all covered. And at times, yes, raising a child is not easy. You need to, doesn't matter if it is firstborn, secondborn, thirdborn, they all come with different experiences. So it is always good that you come and consult people who are experienced, people who are certified to do that work, so that at the end of the day, you don't go home with the information which is conflicting. Yes.
Wow, that's wonderful to see that there's at least a program on how to support these mothers out here. Wow, that's very impressive. And maybe if I could read feedback that we're getting, we have Dorothy Doro, who says thanks. She's watching, she's following. And we also have Mary, who says she's also watching and she's learning a lot. Thank you so much to our dear viewers who are still following. And at this point, maybe we could take a short commercial break. And as we return, we'll talk more about the upcoming breastfeeding week and also the event that will be held at St. Mary's on the 6th of August. And of course, we'll get into details about that and so much more. But at this point, we'll take a short commercial break. We'll be right back. Stay tuned.
Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth. Feeling unwell, seeking expert medical care that prioritizes both your health and well-being? Welcome to St. Mary's Mission Hospital, Langata, where compassionate care meets cutting-edge medicine. At St. Mary's, we believe in providing holistic health care Our dedicated team of healthcare professionals is committed to delivering personalized care to each and every patient. Nestled in the heart of Langata, our hospital offers a peaceful and healing environment for patients to recover and thrive.
We have masses every day, weekdays at 6:30 a.m. in the morning and also in the evening at 6:30 p.m.
Your health is our top priority. Experience the difference with compassionate care you can trust. Whether you're in need of routine medical care, specialized treatment, or emergency services, St. Mary's Mission Hospital Langata is here for you. We offer a comprehensive range of services including outpatient, inpatient services, laboratory services, comprehensive care clinic, MCH and maternity, ophthalmology, pharmacy services, radiology and sonography, dental services, pediatrics, physiotherapy, ICU and HDU services, dialysis.
Here we do dialysis for kidney failed patients, and we do it from Monday through Saturday. We welcome you all. We accept all insurances and cash.
Specialist clinics and CT scan services. Experience your health difference with us. Visit us at Langata or our branches in Nairobi at Cardinal OTUNGA PLAZA and in Rift Valley, Elementaita, Nakuru County. For more information, contact us at 0797 972 794 or 0769 781 880 or 0717 305 204 or email us at info@stmarysmissionhospital.co.ke. St. Mary's Mission Hospital Langata, compassionate in healthcare. Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth.
Hello, our dear viewer, and welcome back to the Health Corner show with me, your host Susan Bulemi. And of course, before we took a break, we were having a discussion with with Dorcas, who is a nutritionist from St. Mary's Mission Hospital, and she has had a lot to share about what breastfeeding entails, and she has talked to us about why it is important for both the baby and the mother, and she has also talked to us about the nutrients that the baby gets to get when you do exclusive breastfeeding, especially for the infant from birth until 6 months. And of course, our dear viewer, before we went on a break, I did mention that St. Mary's Mission Hospital will be holding an event just to commemorate the World Breastfeeding Week, which is taking place from the 1st of August to the 7th of August, and this event will be held on the 6th of August at St. Mary's Mission Hospital. And we would like to get into that with our guest today. Karibu sana once again.
Thank you.
And of course, like I said, an event will be held on the 6th of August. Mm-hmm. Maybe if you could talk to us about what the day will entail.
Okay, on 6th of August, as I mentioned before, the breastfeeding week is between 1st and 7th. Mm-hmm. So we are allowed to pick any day in between mm-hmm. to celebrate. So this year we were honored to have the celebration launched at St. Mary's Mission Hospital. Mm-hmm. And we are having a collaboration between two sub-counties, Langata and Kibra. Mm-hmm. And our meeting point will be at St. Mary's, whereby we are expecting, by the grace of God, that we'll have a walk all the way to the estate, to Langata Road. and back to the institution. Thereafter, we are also expecting to have testimonials. We are expecting to hear from mothers, from grandmothers. Actually, we've had even grandfathers who have come up with an interest of giving a testimony. And we are also having a disabled mother who has done exclusive breastfeeding. So this also shows that we do not have limitations. We can do it regardless of where we are and where we are standing in the society. So it will be a whole day to remind everyone that breastfeeding works, breastfeeding is important, and we need to breastfeed even in the coming generation. We should not shun breastfeeding in the name of how it will get us in a shape that is not very appealing. So that day is open for everyone. It is not only for ladies. You see, there are people who have perception that breastfeeding is only related to mothers, but everyone is open to the celebration, and especially the walk. It is all for the support of the mothers. Yes.
And what impact are you hoping this event will have on the community?
Yeah, we are having challenges in the community whereby, see, our mothers in the community are working mothers. Working in the sense that not all of them are office mothers. They will get maternity leave for 3 months, 4 months. They will give birth today. They are the mother and the father of that family. They have to wake up they will not stay in the house because of one child and they have 4 kids who are starving. They have to wake up and go get something for these other 4. So we are going to empower them and show them that even if it means getting out of that house to go and look for something to do, they can still express this milk and leave it for the caregiver to continue giving the babies. We are going to empower the fathers that they need to give support to these ladies and show them they are wanted, they are loved, so that this able is able to connect herself with the hormones and be able to produce enough milk that our babies need. We are going to empower even those who are employers, that they should support the people who are working under them, so that they are given ample time to breastfeed. And even if they come back to work after the maternity leave, they can also have breastfeeding rooms whereby these people can go and express this milk and keep it there for them to carry in the evening, so that the next day these babies are able to get enough milk from the mother. So it is a whole sensitization, and we are excited as St. Mary's community. We know it will be successful. Yes.
Wow. I like how you've emphasized on how even at our places of work, people could try and create these breastfeeding rooms because it's very important. So it's really nice and it's inclusive, at least for all mothers. And for those who would like to participate in this upcoming event, how can they reach the hospital, or is there also any cost? How can they do it?
For those who want to come and join us during this day as an organization or as an individual, then they are free to visit St. Mary's to get more details on what it entails and the cost that is involved. Yeah.
Okay. And this event, it's about creating breastfeeding awareness. And what hope or what message of hope do you think, or would you like the mothers, especially for the mothers, because okay, we've said that it's for everyone, but majorly it's for the mothers. What message of hope would you like them to have when they leave St. Mary's Mission Hospital on that day?
I would really emphasize that it works. And if I look at the cost of baby formula and breastfeeding, I would still go for breastfeeding because it's cheap, it's available, it's clean, it has all the nutrients that I need. I don't need to get worried when I'm at work that maybe my house manager will mix more than what we asked for or less than what we asked for. So it is something that is doable, and I believe you only need to set your mind and tell yourself that you are going to do it. And as I said before, and I will still emphasize now, as health workers, let us take it upon ourselves to empower these mothers. We start early when this mother comes for the first clinic. Let us prepare them, and even prepare them for the question that you asked, that can breastfeeding be painful at times? Let us give them all the things that are expected during this time of breastfeeding, so that when this time comes, she knows all the things that are going to happen. And when they happen, it is not a shock to the patient. They are prepared psychologically to deal with it. Because I can confidently assure you it's not a very easy task. For a mother who has done it until 6 months, kudos. It is not easy. Yeah. So for those champions who have done it until 6 months, they can also come up and tell other ladies how to go about it. And it doesn't need like fridge. You know, some people will say, I need a fridge. No, that milk, you can express it in the morning, leave it on a table. When it is during a cold season like now, it can stay there for 8 hours. When it is sunny and warm, it can stay there for 6 hours. So I don't need to complicate issues. We can still express our milk regardless of where we stay, regardless of our economic circumstances, and get our baby the milk. Yes.
Wow, that's very encouraging.
Yeah, and even at St. Mary's, we have a breastfeeding lactation room whereby our staffs who come after the maternity leave, they have a place where they can go, express the milk and store in the refrigerator. You only need to label it. Yes. And the refrigerator also is petitioned in by my milk will not mix with your milk. So it is something that it is doable even at the workplaces. Yes.
Wow, that's very great to hear. And also earlier, before we went on a break, we talked about how breastfeeding, exclusively for 6 months, but you can still continue breastfeeding until 2 years. Why?
The first 6 months of life, you're doing exclusive breastfeeding because you're preparing this baby for digestion, and your milk has everything that the baby needs. The first 2 years of life, we call them the first 1,000 days. So this first 1,000 days, this is when your baby is developing. The cognitive development is very crucial at this age. So what we do at 6 months, when this baby is now being weaned off to complementary feeds, we still insist that the baby gets baby breast milk. Reason being, if we introduce cow's milk at this point, the baby is not able to digest, and at times this is what results into allergies. So at 6 months to 1 year, we still encourage our mothers to give breast milk and give food. Then from 1 year onwards, now they can continue with all the foods group that they need. Because our point here is we need a really firm foundation for this child who is growing up. Your milk at 6 months, it might have reduced the amount of nutrients in it and even the quantities, but it is still very, very crucial for this child. So if you continue until 2 years, when you're having this crucial moment of cognitive development or brain development, then you're sure in future you've really built someone who will be of importance to the society. Yes. So the first 2 years, if you can achieve, it would be a plus for your child.
And also there's something you mentioned earlier about how you really emphasize breastfeeding is not only for the mothers. Fathers should also support. And maybe they are watching and they're wondering how we're supposed to support them. What do you have to say to them?
Fathers come in. Actually, according to science, you're supposed to bond with your baby as early as they're in the mother's womb. So the bonding starts there. And the support that we need when this mother is now breastfeeding is for this father to be there for the lady. We don't need them to be there the whole day, but when they are there for the few hours, can you help her get the baby when she's tired? Can you make sure that she's getting enough food that she needs? Can you give her emotional support? There are times after delivery when a lady feels lost. Regardless of the circumstances, at times you feel like you don't even know why you got that baby. So this is when now the partner should come in and reassure and provide whatever foods this lady needs and give support when she's tired. There are these ladies who will stay with the baby, they are tired and you see them sleeping off and they're still carrying the baby. Can you pick it up from that point and give her time to rest? So that at the end of the day we have a healthy mother, a healthy baby and a healthy father in that house. Because there are these small things, if you don't look at them early, then this lady, remember she's at risk of getting postpartum psychosis, especially the first 2 weeks after delivery. So if you don't give her enough support, then get ready. You'll take her to hospital and you'll give the support whether you like it or not. So it has to come naturally. And we also urge our fathers to be attending these programs, especially the support for the mothers. If you look at the percentage of the men who bring their ladies to the clinic during pregnancy and even during this time when babies are getting injection, the first 3 months, after delivery, the number is very low.
Yeah.
Can we create time for our ladies? Can we create time for our mothers? So that they also feel they are loved. They also feel like there's someone who is seeing my effort and who is appreciating whatever I'm doing. Yeah.
And you've mentioned something to do with postpartum. And does it, by the when a mother undergoes it, does it affect the breastfeeding?
It will definitely affect because, as I earlier mentioned, any stress will obviously make the milk production to go down. And remember, when she gets into this phase whereby she's having psychosis, then it means at some point, if it gets worse, she will be taken away from the baby for proper medication. And maybe if she'll not be taken away from the baby, she might be put in medications which will contradict breastfeeding. So at the end of the day, it is not only even the child who will suffer, even the people who are in that house, because now that is now when the baby formula will come in. So let us prevent these episodes, because at the end of the day, they'll have a very big financial impact in that household. Yes, and it only calls for support, nothing more.
Wow. And now, as we are about to conclude, how can the community in general create a breastfeeding friendly environment for our mothers?
Okay. In the community setup, nowadays we have CHPs, the community health personnel, who go around to the communities. In our sub-county, they mobilize mothers on breastfeeding, and this can be done, and I'm sure it's being done in other sub-counties. And the community also, like, recommendation would be maybe in public places, you can have places where our mothers can breastfeed. At times it's very challenging, a child is crying, the mother is walking on the street, she's looking for somewhere to breastfeed, there's no proper place to sit and breastfeed. So maybe also in major towns and even in smaller towns, we can have places whereby it can be designated for breastfeeding. In churches, let us have places where they are designated for breastfeeding, and our workplaces. Yes.
Wow, thank you so much for that. And I like how you've mentioned also in churches, because it's something that I have seen. There's a parish in Ruiru, St. Francis. There is a room for mothers to breastfeed, and you can see how it made things easier for the mothers, because all they have to do is go in there, breastfeed their babies, and they can come back to the church, and everything is normal. So it's really, really important that you've emphasized on that. And now, as we conclude, what is your final message when it comes to matters concerning breastfeeding, and why are we really focusing on that issue?
We are focusing on that issue now because initially we were fighting with undernutrition, but now we are fighting also with overnutrition, meaning we are having so many adolescents, so many adults who are overweight or obesity. And now when we talk about people being obesity in a country, then it also boils down to diabetic, hypertension, inactivity, because when someone is big, they are not in a position to do some of the activities, not all of them, but some. We are also fighting with non-communicable diseases like diabetes, pressure, and we're also fighting with cancer. If we help these babies when they are still young, the first 6 months, and we emphasize on their feeds, especially the breast milk, and then we do proper complementary feeding as you continue with breastfeeding for the first 6 months, we will be able to control all the factors that I've mentioned above. And now when we do that, it translates the economy of the country, because now when we focus our resources to other things other than sicknesses or diseases, then we are able to capture other things that can help the country rather than working on medications and diseases and awareness. So this young generation that is coming up, we really need to empower them. We really need to emphasize that they need this breast milk as the proper foundation. Yes, and also want to tell the young ladies, the fathers, we should also have a habit of having preconception preparation. In our African setup, and most of us, we don't do the preconception preparation. And at times it also works on us when we get to the pregnancy and breastfeeding phase. So let our ladies know that before conception, it is also good to see the gynecologist so that we are able to see the deficiencies that are there in the body, so that we correct them before or during pregnancy, so that when we get these babies, the babies are okay and the mother is okay to breastfeed. Yes.
Well, thank you so much for that message that you had for our dear viewers. And our dear viewer, Dorcas has had a lot to share about matters concerning breastfeeding, and we do appreciate the message that she's had. And we have our viewers who are also following. We have Dorothy, who says, I'm very happy today, and she's excited about the conversation that we've had. Thank you so much, Dorothy, and thank you so much to all our viewers who have tuned into today's conversation, which is very important: breastfeeding. World Breastfeeding Week, of course, which, like I said earlier, begins from the 1st of August to 7th of August. And also, just to emphasize, at St. Mary's Mission Hospital on the 6th of August, they will be having an event to celebrate all the mothers, to create more awareness about breastfeeding, and they're going to educate the general public on matters concerning breastfeeding. So make sure you make it a point to be there on that day and get to learn a lot. And I'd just like to emphasize and to echo what Dorcas has said: breastfeeding is not only for the mothers. We also, as the community, it is our job, it is our role to support them in every way that we can, be it the fathers, be it the sisters to the breastfeeding mothers, the brothers, everyone in the community. It is our task to make sure we support all our breastfeeding mothers and make sure they have a breastfeeding friendly environment. Well, that is all we had for you here on the Health Corner Show. Until next time, stay safe, be blessed. I have been your host, Susan Bulemi, sitting in for Maureen Kimani. Make sure you stay tuned and keep it locked on Capuchin TV.
Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth.
At St. Mary's Mission Hospital, care is more than treatment. It's compassion in action. With 5 fully equipped theaters, a dedicated ICU and HDU, and specialist doctors monitoring patients daily, your health is always in safe hands.
And in my department, we have several theaters that are working. At the moment, the activities are ongoing. And in St. Mary's Hospital, we do more cases, more so in gynecological cases, general surgery cases, ENT cases, pediatric cases, and all other minor cases.
Here we have a bed capacity of 7 beds, 4 ICU beds, and 3 HDU beds. We handle all the cases which are presented in our facility. In our facility, we have a full-time physician who reviews our patients on daily basis and when necessary.
The modern facility features a 10-bed dialysis unit with well-trained personnel that offer nutritionists reviews.
Here in dialysis, we have a bed capacity of 10. We also have an isolation room for dialysis patients who need the isolation room. I have well-trained personnel who offer excellent services to all our patients.
They have a male medical ward organized into 4 rooms to manage different conditions effectively.
We have 4 rooms, and on the first room we have the acute room where we admit most sick patients, and then we have the dialysis patients we admit in a different room, and then we have the suspected TB patients, they have a different room also. And once we confirm, we always put them in the isolation unit.
On top of that, they have a 40-bed maternity wing for both normal and C-section deliveries and a fully equipped pediatric unit with NBU care for newborns.
Our maternity is a 40-bed capacity. We conduct both deliveries, normal deliveries and CS deliveries. Our CS deliveries could be emergency or planned CS deliveries.
We have the NBU, whereby we admit babies who are being born in maternity or in theater who develops complication after birth, and they are being brought to NBU.
Their 24/7 accredited laboratory and fully stocked pharmacy run by qualified professionals ensure timely and trusted medical support day and night.
Our lab operates 24 hours, 7 days a week, ensuring continuous service to our outpatients and inpatients. Our lab is ISO 15189 accredited. This means we meet international standard, and this certificate shows our commitment to providing quality and reliable results.
In terms of having an efficient hospital pharmacy, here at St. Mary's is a very crucial department where at pharmacy we have a team of qualified pharmaceutical technologists and pharmacists who handle all our prescriptions that come from various departments.
At St. Mary's, they are committed to bridging the healthcare gap, especially for the vulnerable through support, kindness, and care.
Vision of the St. Mary's Mission Hospital is to bridge the gap of healthcare, and especially to the people from the vulnerable communities, and is the reason why St. Mary's Mission Hospital was founded. Provision of affordable care to vulnerable communities is our main focus as the church, and when we mean this, we do this through the provision of services like in the HIV realm, tuberculosis. We offer free medical camps, and we have outreaches to meet the health needs of the communities.
They have also come up with a plan to build a home for the elderly so as to provide palliative care for those in need.
And looking at the special need of the elderly, especially at our branch in Elementaita, we are looking at the needs of the elderly, palliative care. So looking forward how we are going to actualize this in the coming years. As I said, that Assumption Sisters will look at the signs and the needs of time. So there are approaches, there are calls, there are requests from people to find out if we have these services within our facilities. And this request is what has prompted us in our strategic focus, in our strategic plan, to look at establishing a home for the elderly and providing palliative care to those who need them.
We have a responsibility to take care of these elderly people, because these are the people who have created the space for us. And therefore, if we can do whatever we can do, no matter how small, even if it is just coming even to see them, maybe once a week or once a month or something, or bringing them some food even or something, or being able to contribute that we build them a dignified house, you know, or being able to give them once in a while, you know, give them a nice celebration where they feel appreciated. I think the help we can give to the elderly is not limited. There is a lot we can do.
They are also shaping the future through Our Lady of Assumption Medical Training College, offering nursing and TVET courses to empower the next generation.
Our Lady of Assumption Medical Training College is owned by Assumption Sisters of Nairobi, and it is inside, the school is inside St. Mary's Mission Hospital, Langata.
We are offering not only the medical courses, but also the TVET courses. So these will help us to mold the young people who are coming up, not only for our facilities, but for the society at large. And by that, then we fill the gap, the needs, the signs of time, the need of the medical personnel in the society.
St. Mary's Mission Hospital. Quality care, compassionate hearts, transforming lives.